Today I'll be talking about treating painful pathologies with a plant-based diet. Now, there are many pain conditions that I see in my practice, including painful peripheral neuropathy, rheumatoid arthritis, osteo-arthritis, and fibromyalgia. And we'll go over some of these conditions, and then I'd like to end with a case study with somebody who has who had chronic back pain and no longer does. So diabetic peripheral neuropathy affects almost half of our patients with diabetes mellitus. And the drugs that are used in treating diabetic peripheral neuropathy have a number of side effects, as you can see from this chart here. SSRIs are used, as well as tricyclics, gabapentin, pregabalin, lamotrigine, carbamazepine, and then some of the more rarer things like mexiletine, which is used when nothing works. And then we try to avoid, as much as possible, opioids, especially the stronger ones. But they all have side effects. Now, if you had a medication that would treat these conditions without side effects, you'd be a multi-million-dollar. You'll be a multi-millionaire. However, using a plant-based diet, you can have not only reduced hypertension, prevent and treat diabetes, inflammation, including vascular inflammation that causes strokes, heart attacks, as well as inflammation in the musculoskeletal system, which can cause pain. But you can decrease hypercholesterolemia. Dr. Christian talked about advanced glycation end products. And you can also decrease oxidative stress. And all these things can work together to decrease pain. This study, done about 25 years ago, published then, shows that patients on a vegan diet, a plant-based diet, experience 80% abatement of pain in 1 month. So we're not talking about years or months and months and months, but in 1 month, 80% abatement of pain. Like I said, if you had a pill that can do this, you'd be all set for the retirement. 65% decrease in medication for diabetes. 71% continue to be pain-free after 4 years. 17 out of 21 patients placed on a plant-based diet had, so this is the data that we talked about, in 1 month, complete abatement of pain, and many achieving that end stage in as little as 2 weeks. Okay. Also, long-term results were maintained in 71%. And then the authors of that study they wrote, in our opinion, these results appear to be related to factors in the total vegetarian diet and not necessarily to an improved glucose control, since the serum glucose was not under good control until about the 10th day. So even before you see the glucose being controlled, you start having pain reduction. Any questions about that part? Now we're going to go to rheumatoid arthritis, painful disease, and a significant proportion of people with rheumatoid arthritis will try complementary and alternative interventions. And this shows that there is a lack of satisfaction with modern approaches, especially with the biologics, which can really, really help. But then the problem, as you all know, are the side effects. And some of them can be quite dangerous because of the effects in the immune system. So conventional anti-rheumatoid medications include methotrexate, sulfasalazine, hydroxychloroquine, leflunomide, and azathioprine. And then you have your biologic agents like infliximab, etanercept, adalimumab, golimumab, certolizumab, and then your T-cell blockers, abatacept, and then your anti-interleukin 6 receptor, tocilizumab, and anti-CD20, rituximab, as well as tofacitinib. And all these medications have challenges, as you all know, that they have these side effects. And if you look at people who are plant-based, they don't have as much. In other words, this slide has it as the prevalence of rheumatoid arthritis and rheumatism was 50% greater in non-vegetarians. So that's a very interesting study from the Adventist Health Study, which Dr. McGee also referenced. Now, another finding is that people who have rheumatoid arthritis have higher levels of Proteus mirabilis antibodies when compared with healthy controls and subjects with other diseases. And vegetarians have significantly lower mean antibody levels against Proteus mirabilis, which correlated significantly with measured decrease in disease activity. So, when you prescribe a vegetarian diet to people with rheumatoid arthritis, they have significant improvement in decreased joint swelling, the pain score is decreased, their grip strength is increased, morning stiffness decreases, as well as not only the severity but the duration, and function increases. There are fewer swollen joints and fewer tender joints, as well as improvement in Ritchie's articular index. And you can, as Dr. McGee talked about, you can show them the lab results. They'll have improved leukocyte counts, decreased IgM antibodies, RF factor, a rheumatoid factor will decrease, as well as decreased complements, C3, C4. ESR decreases, C-reactive protein decreases, as well as a reduction in Proteus mirabilis. Any questions about RA? Now, we're not going to go too much in depth on osteoarthritis because my case study involves somebody who had this kind of inflammation. But for osteoarthritis, there is no disease-modifying drug that has been approved by the FDA, nor are there any structure-modifying drugs which have been approved by the FDA. So what are available for our sufferers with osteoarthritis? We have Tylenol, acetaminophen. We have non-steroidal anti-inflammatory drugs, both oral as well as topical. We have calcium channel blockers and COX-2 inhibitor combinations. We have intra-articular corticosteroids. We have hyaluronic acid. We have opioids. We have duloxetine or venlafaxine. And then we also have muscle relaxants. And as you know, they all have side effects, many of them serious and severe. However, if you put patients on a plant-based diet, they have significant decrease in pain and increased function. And this was from a recent study on osteoarthritis and plant-based diet. Let's move on to fibromyalgia. As you know, the old criteria included 11 out of 18 tender spots. That's by the American College of Rheumatology. And now we know that it doesn't have to be 11. But there is widespread pain, both above and below the belt line, both right and left. And standard treatments, again, have very high side effect profiles. And amitriptyline is used, as well as other tricyclics. We have cyclobenzaprine, duloxetine, as well as venlafaxine, milnacipran, pregabalin, and combination of tramadol and acetaminophen, as well as others. But the main thing is all these medications have a lot of side effects. However, plant-based diet, you cannot get this kind of results with most of the medications listed on the previous slide. 70% report increased well-being and reduced pain, with significant decrease in serum peroxide, including which shows that there's improved antioxidant status in these patients. Any questions about fibromyalgia? So if you had a drug that gives you this kind of result without any side effects, you know, you'd be all set. And yet patients who are treated with a vegetarian diet have a decrease in fibromyalgia impact questionnaire score of 46%. And you have significant improvements in shoulder pain at rest and after motion. You have improved range of motion, improved flexibility, and improved chair tests and 6-minute walk. The distance people can walk in 6 minutes. So let's look at Dave. And this is a gentleman with one of the best results. Not everyone I speak to and try to motivate them to adopt a plant-based diet does it. And some people, they try the flexitarian and they get some results. And but to this day, this person had the best result. And I just wanted to present you Dave. And he got injured at work in 2009. And so it was quite a while ago. And he was lifting something when he had sudden onset lumbar pain and extending into the left lower limb. And you probably have, if you're in primary care or occupational medicine, you probably have heard this story many times. So with regard to his situation, he's married with 2 children at the time, 2 dependent rather. He was a smoker, but no longer at the time of presentation. He drank wine on occasion and used caffeine throughout the day. Family history was significant for diabetes in the father and hypertension in the mother. And he also had elevated blood pressure at that time, and so his doctor put him on lisinopril. But he was also taking ibuprofen, 800 milligrams 3 times a day. On examination at that time, he was 5'9", weighed 212 pounds with a BMI of 31.3, which is obese. His blood pressure was high, 148/88. His heart rate was 76, respirations were 16. And at that time, he could not flex more than 65 degrees forward. He also had decreased left ankle jerk, decreased strength, 4 out of 5 for left dorsiflexion and plantar flexion. And he did not have as good sensation in the lateral aspect of his left foot. So an MRI was done, and it showed a lumbar disc herniation at L4-5, not surprisingly. So he was placed on light duty. He got some chiropractic. He got, they upped his medications. And then he was sent to an orthopedist when none of that really gave him any relief. He was given a series of steroid injections in the spine. But after his last injection, I believe he had 3, the pain returned about a month after that. So there was diminishing returns. And you probably have heard that story a lot too. About a year later, he underwent L4, L5 microdiscectomy and was given a short course of opioids, during which time he had pain improvement. But then after that initial improvement, pain returned after the opioids were taken away. And he had recurrent lumbar pain in September of 2010. By October, he was considered a patient for lumbar laminectomy. And then he eventually had so much pain that, and radicular pain, that he sought a second opinion. MRI at that point showed degenerative changes and epidural fibrosis, causing lateral recess stenosis at L3, L4, L5, and S1. And so the patient was subjected to lumbar discography, and lumbar fusion was recommended at that time. In January 2011, he underwent posterior lumbar spinal fusion with pedicle screw instrumentation. And not surprisingly, after the oxycodone was taken away, he continued to experience chronic pain despite the surgery. And it was at that point where he was referred. When I saw him, he could not stand straight, and he weighed 30 pounds more than at initial presentation. He could barely lift 15 pounds in a crate, and he reported 10 out of 10 pain, and he had the pain behaviors to go along with that report. So I introduced to him the concept of plant-based anti-inflammatory diet, explained that this has helped many people. I also explained the importance of reducing neurotoxins, and told him consider just using water instead of alcohol and caffeine. And suggested, starting out with some gentle physical therapy and then increasing as he could do more. And the reason the plan worked for him was because he decided to go for it. I didn't have much in the way of motivational interviewing skills, but for some reason he was ready. He was just sick of his life being this way. And so he tried it. He ate a lot of berries. He brought a whole bunch to the physical therapy. And then 2 weeks later, he noticed decreased radicular pain. And a month later, he had no back pain, and his range of motion was improving. And so he was able to continue physical therapy in earnest. And by July, he was lifting 100 pounds on an occasional basis. This was a guy who couldn't lift 15 pounds in a crate. And eventually, he lost the 50 pounds he had put on, and walking straight, fully painless. By August, he was interviewing for work and is working today, doing very well. And he was really ecstatic about the role of plant-based diet in conjunction with rehabilitation had in treating his chronic low back pain. Any questions? So you can see that no matter whether it's rheumatoid arthritis, fibromyalgia, osteoarthritis, people improve. Now that I learned about motivational interviewing through Dr. Wyman's talk, I'm going to try to put that into use. I really like that, because a lot of people, when it comes to diet, you know, they are contemplative. But now that I know this, I've actually been broaching the subject. After Dave, I've been discussing it with every pain patient, at least introducing the concept. And some are not ready, and some are. And those who are, they really do quite well. But Dave was the only one who reached 100 pounds in a couple of months. So that's why I wanted to talk to him about, talk to you about him. But I'm sure that there will be other Daves, especially as I get more skillful at motivating people, or helping them motivate themselves. Any questions? Yes?
Do we know the mechanism for any of that? Is it the weight loss that's reducing the pain symptoms, or is it something?
Remember, he started having reduced pain before he lost weight. So it's not weight loss. We think there are at least 3 mechanisms that, to me, make sense. First is that many plants tend to be anti-inflammatory, whereas all animal products are pro-inflammatory. The second mechanism is that plants have a lot of fiber, and fiber will help you reduce blockages in your blood vessels. As was mentioned by Dr. Malhotra, you know, Cadwell Esselstyn's famous study where within 32 months, the coronary arteries had reversal, angiogram-proven reversal. So we have that mechanism as well, because every cell in your body needs nutrients in and waste products out, right? If you can get nutrients in and get the wastes out, you're going to have a better functioning cell. When you can't get the nutrients in, the cells are going to tell you about it. It's going to hurt. When the waste products build up, especially lactic acid, it can burn. It can really be very painful. A third mechanism I believe is essential is that the kind of plant-based foods that are present in whole plant-based diets are high in fiber and nutrients, and it will tend to improve your gut microbiome. So the gut microbiome becomes more favorable. You start producing substances that enhance your well-being and happiness. Did you know that 80% of the serotonin, the feel-good chemical in your body, is in the gut? It's not in the brain. Brain has about 20%. And so if your gut is happy, you're going to be happy. And if you're happy, you may not really be that bothered by nociceptive signals from a leaky disc hernia, which is maybe sending off some signals to the nerves in your leg. It may not be so bothersome. It may be something that you might be able to completely ignore and not have to seek surgery or any injections or any such intervention. And sure, there is a role for surgery. If there's compression, if there's bowel and bladder dysfunction, if there are any of these red flags, yes, definitely need surgery. But most surgeries for disc herniations are absolutely not necessary. So I think those are just some of the mechanisms, and there are probably others that we are totally unaware of. But plants have been demonstrating again and again that they are put here on Earth for our benefit. And it really does well for us to take advantage of plants. And as was mentioned again and again, it's inexpensive, it's right there, and it just makes sense for the environment, it just makes sense for health and happiness, well-being. We just have to shake this delusion. It's like a big delusion that we need animals to eat in order to feel good and be healthy. All right, thanks so much for your attention.